Hello and welcome to my health channel. Today I'm going to talk about one of the men's health issues. Men certainly have a unique issue such as prostate problems. Prostate is a gland found in the male reproductive system. Prostate surrounds part of the urethra. It is simply a tube that empties into the bladder. It is also a tube that men pass urine and semen through. It's located in the pelvis between the penis and the bladder. 1 in 3 men have symptoms at some point. Doctors refer to the problems that affect the way a man pees as the lower urinary tract symptoms or bladder outflow obstruction. Prostate produces a fluid that forms part of the semen. The most important function is the production of fluid, which together with the sperm cells from the testicles and the fluids from the other glands make up the semen. It is the muscles of the prostate that enables the semen to be forcefully pressed into the urethra and then expelled outwards during ejaculation. Okay, now we're going to look at the main causes of prostate problems. Sometimes it's family history. So if a man has a father or a brother who have or have had prostate cancer, then as a man, the man is more likely to develop it. So it's advisable to check the PSA levels, which is the prostate and specific antigen levels from age 40, 45, at least by 50, okay, or earlier if you've had symptoms, okay. We know 1 in 4 black men have received a prostate cancer diagnosis compared to 1 in 8 men generally. Okay, we also know that only 2 in 5 people know that being age 50 or over increases a man's risk of prostate disease. Only 1 in 20 people know that being black increases a man's risk. Okay, so the second one is diet. Research has shown that prostate cancer may be higher in men who eat very high fat diets. Okay, it's also linked to hormonal changes as a man gets older. Okay, the balance of hormones fluctuates or increase. Okay, so the warning signs for prostate problems are when a man starts having slow and weak urine flow. Most people with prostate have trouble urinating, especially as they get older, and may not be due to prostate cancer. Frequent need to urinate, pain or burning during urination, blood in the urine, prostate pain, loss of bladder and bladder control, ejaculation issue, pain or numbness. In addition, some men may just have prostate infections such as cloudy urine, pain in the abdomen, groin and lower back, also blood in urine, urgent need to urinate, frequency in urination, particularly at night, dribbling, pain, burning sensation when urinating. Okay, it doesn't mean that everybody who's had these symptoms has cancer. Okay, so it's important that you go to your doctor when you're experiencing any of these symptoms. Okay, now how is it diagnosed? There are some tests that your doctor may want to do or investigate. These tests may be needed to rule out other conditions such as prostate cancer. It is important for your doctor to ask the man what the symptoms are and what their concerns really are and how this has impacted on the man's quality of life. Now, one of the tests that needs to be done is fluid intake. Okay, it's important to get a fluid intake and for this to be recorded. This is because the doctor may want to know how much fluid you get rid of on a daily basis and may want to know if there is any form of leakage. Okay, so this is very, very important. Now, another test that needs to be done may be to perform a physical examination to examine the man's stomach and genital areas. Rectal examination may be done because they can feel the prostate through the wall of the anus or the rectum. Blood tests, like I said, to check for PSA levels through a blood test, okay, and to check if the kidneys are working properly. The PSA test is very important because it rules out prostate cancer. It is called the PSA test. Okay. Then urinalysis, the doctor may want to check for glucose and blood in the urine, to check for diabetes as well, and if there's an infection. Other tests may be considered, but this will depend on the symptoms. Okay, so I think it's very, very important that some people can differentiate between prostate cancer and prostate infection. Okay, symptoms may be similar, and it's important that you speak to a doctor about it. Okay, it's only 2 in 5 people know that over 50 that they are likely to have cancer. 1 in 4 black men get a diagnosis of cancer. Okay, check your PSA levels when you get to 40 years onwards. Okay, if you look on the screen, you will see the reasons, many reasons why people can get all these problems. Okay, you must be prostate aware. Okay, and make sure you have your test. Thank you for watching. Okay, share my video to every man that you know, okay, over 40 years of age. Okay, and it's also important for everybody to know, so you can be able to advise your family, your friends. Okay, women can watch it as well and advise your family if they're experiencing any of these symptoms. Okay, it's very good to be aware and be able to use that information to help other people. So I'm going to say now, thank you very much for watching. Subscribe, like, and comment. Okay, thank you so much.